Yeah, thank you very much, Katrine. The death toll from the Ebola outbreak in West Africa's three hardest hit countries, Guinea, Liberia and Sierra Leone, has now risen to 5,147. The World Health Organization reports show that Ebola is still spreading intensely, especially in Sierra Leone, where hundreds of workers at a clinic have also gone on strike now. Earlier this week, relief organization Doctors Without Borders issued a warning that the epidemic has already entered a new phase. While the international response is finally scaling up, MSF is concerned that the strategy and approach to the epidemic are already outdated and relate to the needs of 2 months ago. Now, joining us today is Jens Pedersen, MSF South Africa's Humanitarian Affairs Advisor. Very good morning to you, Jens. Thank you for joining us. We saw what the UN said a little bit earlier, that they believe as they go out into the villages that the true scale of this epidemic will come out. The latest information and your views.
It's absolutely true that we are discovering more as the response gets underway. It also indicates the challenge of the current data sets, because we do believe that there is much more and many more cases that have gone unreported. Now, the challenge of this is, as we move from the cities and from the current locations where centers have been set up to new areas, the response needs to adapt to that. It's simply not enough just to find cases, but there needs to be put in place procedures, treatment centers and so forth to deal with the cases. And that's what we are critiquing with the current response, which is simply not adapting quickly enough.
You spoke, we spoke ourselves here about the epidemic now entering a new phase and that the international response is about 2 months behind this. What do you mean by this, and what do you think the international community should be focusing on then?
To give one example, 2 months ago or several months ago, donors and organizations allocated and received money to build treatment center in one location.
Yeah.
Now we're seeing a change pattern in the outbreak, so you will need a transfer of those resources to a different location, to be very practical.
Yeah.
Now, there are bureaucratic and administrative obstacles that prevents the transfer of that response. So we are stuck in locations where 2-3 months ago made sense, but not being able to simply move where the needs are at the moment.
Bureaucratic bungling, it seems, is always a problem when it comes to relief efforts. What is needed now?
What's needed now is that, first of all, we must acknowledge that although we are seeing a decreased number of cases admitted to our facilities, we are still far away from the end of the outbreak. So the efforts needs to be sustained. This will be a long effort. As we are seeing, for example, in Monrovia, fewer number of Ebola patients being admitted, we need also to start focus on the other issues of a healthcare system that has collapsed, such as children suffering from malaria, pregnant women needing safe deliveries and so forth. And then, when it comes to Ebola, we need to make sure that there is a mobility in the response that can allow to follow the outbreak as it evolves.
Yeah. Just paint us a picture of the current situation in Liberia, Guinea, Sierra Leone, the different countries. What kind of crises are affecting the countries? Is it as much economic, one would think, as it is with the movement of the disease?
There are many, many severe consequences of the Ebola outbreak. The number of infected and number of death is the tip of that iceberg. There are high numbers of families that have been torn apart, children that have been orphaned. There are potential issues when it comes to food security, because farms have not been yielded, they are not being planted or harvested later on. And all these ramifications spread slowly like rings in the water.
Yeah.
What we're seeing now in Liberia is that there has been a community mobilization to protect themselves. But on the other hand, in Sierra Leone, we've seen that over the past month, the number of cases have doubled.
Yeah.
And in Guinea, what we're seeing is that the treatment facilities we have, in particular in Conakry and in some of the more urban areas, are slowly being filled to capacity, and there needs to be more done in Guinea. A lot of focus has been given to Liberia and Sierra Leone in particular, and Guinea has been a little bit in the shadows in terms of international response and assistance provided.
What are the main obstacles then that you see in this short and medium term in dealing with the spread? And also, do you believe what the UN is saying, that they believe we're slowly starting to win this fight and contain?
I would like to believe that we are starting to win this fight. It's too early to say so, in my opinion. We need to continue the efforts. In the short term, what needs to be done is that we need to recognize that the outbreak is incredibly unpredictable. We've seen spikes and increase and decrease in numbers of cases continuously, and we need to be able to adapt to that. In the medium term, we need to mobilize healthcare workers, not just funds. We need to not just build treatment facilities, but we also need to make sure we have nurses and doctors to work in these facilities. They need training, they need proper supplies of protective gears and so forth.
We also see, we see now that hundreds of workers, clinic workers or medical workers in Sierra Leone have also gone on strike now. How difficult are the conditions that they're working under?
Well, in some of the conditions, in some of the facilities, in particular the ones where there is perhaps not the needed support from organizations, it is very difficult. First of all, it's very, very stressful as a healthcare worker to work in an Ebola environment because your patients suffer tremendously and you do not have the same remedies as you usually do to treat your patients. As healthcare workers, we also take risks, and it's important that to care for Ebola patients, we are being provided the tools to protect ourselves. Now, if healthcare workers are not giving those tools, then it is incredibly dangerous.
Yeah. What about the spread outside of those countries? We see new cases being reported in Mali. How is that being responded to?
Well, we've seen now some isolation or containment measures being put in place in Mali. I think it's important, as we've seen in many other countries as well, that we cannot quarantine our way out of Ebola. We need to make sure that we have a system in place based on trust, where patients or people who have had contact with Ebola are willing to come forward and report, and we then can monitor whether these contacts develop symptoms.
Let's move this a little bit forward one day. Let's hope it's in the near future. If we see an end to this deadly virus, do you see countries like Guinea, Sierra Leone, do you see them recovering completely, especially the health systems in those countries and the economies? And what sort of time frame would you think it would take for them to recover?
I see them recover. I've worked both in Sierra Leone and Liberia, and it's the people of Sierra Leone and Liberia are incredibly hard-working people. They've, in both countries, have gone through long times of civil war, incredibly brutal and devastating civil war, of which they have slowly recovered. Now, faced with Ebola, all of this gets challenged once again. But knowing my colleagues and knowing my friends in Liberia and Sierra Leone, they will recover. It's important, though, even to keep in mind that they deserve support, and it's our responsibility as healthcare workers, as fellow citizens, to support them in that.
Talking about that support, in conclusion, just tell us where people can pledge their support and what they should be doing to support your effort at Médecins Sans Frontières.
Well, we've been fundraising for more than a month now to enhance our response to the Ebola, and people can SMS join to 41486 or can go to the website www.decidetodonate.org.za.
Well, Jens, thank you very much for joining us today. We've got it all on screen for you right now. That's where you can go and make your contribution. You can SMS your contribution. It's that easy to make a difference in dealing with a scourge that's really affecting Africans as we speak. Thank you, Jens Pedersen, who's the South African Humanitarian Affairs Advisor for Médecins Sans Frontières. Thank you once again for joining us.